Welcome back to the Anja Health Podcast. Today we have midwife Abby Vidikan with us. I'm so excited. Thank you so much for taking the time. I know you just came from a birth. How was it?
It was great. It was fast.
Okay,
Very
cool.
fast.
That's awesome.
Yeah. She actually just texted me that she feels like a changed person.
Oh, wow.
Yeah,
That's so
it's
sweet. But cool. Well, yeah, I'd love to know more about your background in general, how you got into midwifery, and yeah, also how people can find you because I know you're a pretty notable midwife in the LA area.
Yeah, so I actually came to midwifery kind of in a roundabout way. My aunt has been a midwife for 20 some odd years, and she started on the
Awesome.
home birth in the home birth community, or rather like as a home birth midwife. So I think my first introduction into midwifery as even like an option for women's healthcare was through her. She was in school when I was a teenager, and so she was really like my first introduction to that model of care. And then while I was in college, I went to USC. And her office was in Orange County. So while I was in college, I would go visit her and I would see her interactions with her patients. And
Mm.
it was just another level of care that I don't think many of us have ever experienced, in the sense that like there was this mutual sense of respect for one another. There was a love for one another. Like you could tell that when they were completing their care with her, that there was a sense of like loss that they didn't get to continue their time with her until they had another baby. But I was set on getting into politics, possibly going to law school. Like my
Wow.
life was geared in that direction. So when I graduated from UIC, my husband and I, we got married about a year after I graduated, and we moved to Washington, D.C. actually. And I worked in a political nonprofit there. And it wasn't until I got pregnant with my son, started my own relationship with a midwife, or actually with a group of midwives, and experienced life, I guess, on that from that, or rather, I guess, experienced care from that perspective, where I was like, there's something to this. And I think I was like 35, 36 weeks pregnant when I called my aunt, and I was like, I think I need to pivot my whole life
Wow.
and get into this field. And one thing about me is I've always been, very driven. If I set my mind to something, I kind of go for it. And I think I just knew then. And she's like, well, hold up, have a baby first, and then we'll see where things go. And having him, only I think in so many ways reinforced why this model of care is so important, and how, monumental and momentous this time in a woman's life is.
Hmm.
And I just wanted to be around it all the time. And I can't have a baby every day, but I can certainly help women have a baby every day. And that was it. We moved back to LA 6 or 7 weeks after my son was born, and I enrolled in midwifery school right around the time that he was a year old. And I started when he just before his second birthday.
Okay.
And
Wow.
I have honestly never, like, I haven't, like, in 10 plus years, I haven't looked back.
Yeah, that's so awesome. That's so interesting. Yeah, because I feel like it's always interesting chatting with midwives that are US based too, because I feel like in the UK, especially, midwives are so much more common. So sometimes like I'll chat with people about guests on our podcast that are midwives, and people will be like, "Oh, well, what even is a midwife?" And yeah, so I think it's just so admirable, especially because I've read studies around like midwifery being able to reduce interventions and things like that. So yeah, that's super awesome. If someone is considering a birth provider right now, what would you say to them around like potentially considering a midwife?
I mean, I think it really starts with, like, where you feel safest giving birth. As much as I
Mm,
am a home birth advocate, and home is where I feel safest and it is where I feel I do my job best, you have to feel safe in that environment. And
right.
ultimately, where your body will lead you to the environment where you feel safe. And if that's a hospital-based birth, then that's where you should go. But start with, I mean, ask everybody should interview their provider. Just because your friend had a great experience with the doctor doesn't mean you're going to like the same person.
Right.
If you're not looking for the same experience, you should, you should consider other options. So start with just asking questions about things that are important to you. If you want an epidural but you still want choices, ask about the things that matter. Like,
Hmm.
how do you feel about a woman pushing in different positions? Even if I'm on an epidural, can I use a squat bar? Am I going to have to be on my back? If you want an unmedicated birth, how many unmedicated births has that provider seen in a year, in 2 years, in 10 years? Because if your provider says to you they've never seen one, they're probably not the right person for you. Ideally, you want an
Yeah.
expert in the type of birth that you're looking for. So if that's a home birth, you want an expert in home birth. If it's a hospital birth that's unmedicated, you want someone who, the women in town go to that guy or that woman because that's who they are most successful at having an unmedicated birth with. So it's asking the questions about things that are important to you. And I think it has to start there because I was just reading a study that it's something like 40% of women are unhappy with their birth experiences.
Mm,
My son's birth changed my entire life.
Mhm.
I mean, it changed the trajectory of my whole life. It changed my outlook on everything I'd wanted to do for the rest of my life. And so, in so many ways, that's the experience you want for all women. They shouldn't be leaving that experience thinking, I was let down. No one listened to me. My voice wasn't heard that day. And, beyond, and I think we set the standard in this country for healthy mom, healthy baby, but it has to be more than that.
Mhm.
Yes, obviously that is the gold standard for everything, a healthy mom, healthy baby. But what about a mentally intact mom? What about a mom who doesn't feel traumatized by her birth experience? And those are things that I see day in and day out. I have plenty of women who come to me after horrible hospital experiences, and I hold space for those stories, and I
Mhm.
listen to them and I hear them out. And my goal is to always, make that second birth that much better. And look, it can happen in the home environment too. It's not to say that we're all perfect, but I think first and foremost, it's about listening to women and respecting what their wishes are, as long as they're medically sound, but obviously respecting what they want, respecting what they desire. And I think any provider can do that.
Yeah. Okay, that's awesome. So do you mainly support home births or do you also do hospital and birth center births?
I used to do what's called monitrice care, where I would support hospital births. So like labor at home, as someone kind of be the midwife at home and then go with them to the hospital.
Mhm.
Honestly, my practice has just gone to a point where I can't, I can't, I can't get stuck in a hospital long. And I think also like the more I do this out of hospital, it's really hard to go
Mhm.
into the hospital and see things done so differently. Um, but every so often, I'll sprinkle on a hospital birth. One of my best friends likes to give birth in the hospital, and I've been with her for all three of her births. And so,
Oh, wow.
yeah, it keeps me humble in doing what I'm doing. I worked at birth centers for a couple of years, and honestly, it's not where my passion lies. I think
Mm.
birth centers are a great medium for women who don't want to give birth in a hospital but can't quite make the leap to home, or they don't feel as comfortable in their home environment.
Mhm.
But ultimately, I will always maintain that I think birth works best at home, that there is a sense of peace going into labor, having your very first contraction and not having to worry about leaving your home, but instead having just everyone come to you.
Hmm. Okay. Awesome. Cool. Well, as you know, we at Anja Health do cord blood banking.
Mhm.
So I wanted to pick your brain on being able to take stem cells from your umbilical cord and placenta. So, in your eyes, what are the pros and cons of cord blood banking and how do you approach it if patients ask you about it or clients?
Yeah, so I think much like any sort of insurance policy. I think that there is, down the road, there's a lot of potential for what stem cells can provide. So I think the benefit long term, especially, is like, who knows where science is going? I mean, things change day to day.
Hmm.
My son is actually a type 1 diabetic,
Oh, okay.
and there's a ton of research in that field right now
Yeah.
in the diabetes community that all has to do with stem cells, and the potential, so much potential to have a cure for diabetes. They say, anybody who's had diabetes for a long time will tell you, they say there's a cure 5 years out every
Yeah.
5 years. But, I mean, I think even where they've come in the last 10 years,
Hmm.
my son has the potential for a long life given the medical advancements just over the last few years by comparison to people that were diagnosed 40 years ago who were told they wouldn't live past the age of 40.
Right.
So, even from my perspective, like anybody with autoimmune disorders, anybody with blood cancers, there's so much potential for stem cells. I sit kind of in this middle ground because there is a part of me that values delayed cord clamping.
Hmm.
If stem cells are so valuable, why aren't we giving them to our babies at birth? So it's actually been really cool, somewhat recently, to be introduced to the ability to fully delay cord clamping and then actually utilize gravity after the fact
Hmm.
to bank cord blood.
Yeah.
And me and my midwife assistant Johanna, and there's a fabulous obstetrician that we work for named Dr. Affleck, or that we work with, Dr. Affleck. We have actually very successfully been able to bank cord blood, and a lot of cord blood, after fully delayed cord clamping, which has been
Yeah.
really cool to see, because I think for so long we kind of stood at this place where, hey, if you want full delayed cord clamping, we can't really do this. But now, I mean, after the last 3, 4, 5 times that we've done it, we've managed to get really good samples that have been accepted by the labs. And so
Yeah.
it's been a nice middle ground now.
Yeah.
Yeah.
Yeah, definitely. Yeah, we typically tell parents like we aim for around 2 minutes of delayed cord
Mhm.
clamping and then banking the rest. But yeah, even if they choose to like wait until it completely stops pulsing and there's like no cord blood that they're able to get, then they can still bank cord tissue and placenta stem cells with
Yeah.
us. So yeah, so there's really all kinds of options that parents can do.
So what I've been telling my clients is that if you are completely married to the idea, meaning that like you can't envision a world where you don't get this blood,
Hmm.
then don't delay.
Mhm.
We'll delay it for a few minutes, right? We'll go based on the company recommendations, delay for a few minutes, clamp, and then we'll be able to preserve the rest. But for my clients who are kind of open, where they're like, "Hey, yes, I would really like it as an option, but I completely understand if we don't get enough blood." That is where I think that happy medium of like, okay, we'll see what we can get after the fact, and we'll
Yeah.
bank that. But yes, I have a lot of clients who have done tissue, who've done placental fragments, who've done cord. But so far we've managed to actually collect, ample samples and be able to
Yeah.
send them. So it's been really cool.
That's awesome.
Yeah.
Cool. Well, yeah, I know you mentioned that you have kids. So
Mhm.
did you do cord blood banking for the births of your kids?
So my oldest is almost 12. So when I had him, I don't even remember actually anybody approaching me about cord blood
Mm.
banking. I think I read an article about it in People magazine, and that was the extent of my knowledge. By the time my 7.5-year-old was born, I mean, again, we kind of stood at this place where it was like, unless you want to clamp the cord at 2 minutes,
Mhm.
then there's nothing to bank. She was actually really tightly wrapped in her cord, and that placenta
Oh,
separated. Oh yeah, her placenta separated very quickly. So I don't even know that we would
yeah.
have gotten anything.
Mm.
And then with my youngest, again, it was kind of like I'd rather he get all of it. And because we were still in the impression like you couldn't do both,
Mhm.
I chose to do full delay cord clamping and not cord blood banking.
Okay, cool. But now knowing that you can do both, would you consider cord blood
I
banking?
would have. I totally would have. I would have definitely. Why not? I would definitely would have tried to. And again, knowing the effect that it could have on my older son's life, down the road, or with whatever medical advances we're able to make using stem cells, why not?
Yeah. Yeah, in 2012, they published this study that they were able to reverse type 1 with cord blood stem cells. So, yeah, there's definitely hopefully promise on the horizon.
Yeah, and he was born in 2011. He was diagnosed in December of 2020, so we're still
Mm,
just under 3 years in. But
okay.
even all of the studies that they're doing right now, there was just a drug that was approved called teplizumab.
Mm.
All of them they're rooted. So except for like the beta cell transplants, they're all rooted in stem cell research. So
Right.
it's very cool to see what could be on the horizon. So for me, and I tell my clients that too. It's like obviously because when having the conversation with people, I never wanna come out as, like, in favor of one thing. Like, I want to approach every conversation, every informed consent conversation with my clients is coming from this middle perspective. Like, "Hey, there's these 2 options or sometimes 3, sometimes 4 options. We can discuss all of them." But I
Yeah.
say there's a lot of personal gain for me if given stem cell science and stem cell research for my own child. And so, obviously there's a part of me that very much comes out in favor, but it's just, it's having that balance and making sure that their needs are being met at the same time.
Right. Yeah, that's awesome. Yeah, I feel like our goal at Anja Health is just to make sure parents are at least informed of it because
Mhm.
we get so many comments on social media along the lines of like, "Oh my gosh, no one told me this." And so, yeah, it's good to have just like informed consent options.
Yeah.
Awesome. Well, I'd love to move into midwifery in general and how you think about that, especially because I think midwives are so relatively uncommon in the US, but I feel like they should be used more. So, yeah, I'd love to get your take on what is the difference between a midwife, doula, and OBGYN, because that's a really common question we get from our community.
Yeah. So I'll start with a doula. So they are a trained support person for
Hmm.
labor. Trained in that they generally will do like some sort of doula intensive, whether it's a weekend, whether it's a couple of weeks. And then there's other requirements if they want to become certified. They're trained and experienced, a very skilled support person. Doula has no medical training though, so they are very well versed in what labor looks like and what the natural progression of labor is and how to help with all kinds of comfort measures. When it comes to, let's say, hospital births, they'll discuss birth plans and they'll be there as sort of the woman's advocate or the family's advocate, just to make sure that her wishes or rather that her needs are being met in the hospital system. And they're there solely for physical and emotional support. And I say solely, not that that is not a very big job. It is a very big job. But they don't have any medical responsibilities and they have no medical training. I will say that doulas are worth their weight in gold, and I would never fathom birthing without one.
Do you use a doula for your
I
births?
did for all of them.
Awesome.
Yeah, I have a lot of friends that are doulas, so I couldn't exactly get away with not having one. And I do really value their place in the birth space. I think that
Yeah.
they're such a vital, or they can be such a vital part of a birth experience that for me, I couldn't see it any other way. But a midwife is a medically trained provider. Here in California, we have 2 different types of midwives.
Hmm.
We have licensed midwives and we have certified nurse midwives. The difference is the route, I guess, or the method of education, the schooling that they got in
Yeah.
advance of becoming licensed. But here we're licensed through the Medical Board of California or the Board of Nursing. So we're very much, a part of the medical care system here in California. There are states that don't have licensure for midwives, but we happen to have actually very strict, kind of rigorous licensing processes for us. Midwives, we consider ourselves more holistic providers in the sense that we look at the whole body. So, mind, body, spirit, whenever we approach our clients' needs.
Mhm.
So, outside of, checking someone's vitals and making sure that their baby's okay and feeling their belly, we are also checking in with them about their stress levels, how they're sleeping, what are their what's their exercise regimen look like? Can we look at their diet and maybe make some suggestions that would help them feel better?
Mm.
We make supplement recommendations, but it's really about looking at the whole person, making sure that, mentally they're not experiencing any fears or anxieties as they approach their birth. And an obstetrician obviously is a doctor. They're also surgeons. So where midwives can attend to much of, a woman's health care from, the time that they start menstruating until menopause, we don't do surgery.
Mhm.
And, there's other things medically that we don't do, where obstetricians will obviously they, deliver babies, but they can also do surgeries, cesareans, and other things. Went to medical school, etc.
Yeah. Okay. That's awesome. A very thorough explanation. Awesome. Well, I know that you tend to support home births. So, how would you personally compare a home birth versus, I know we touched upon a birthing center birth and also a hospital birth, and why did you choose the birthplace that you chose as well?
So a hospital is a hospital. Ultimately, I think for anybody who, again, has anxieties about being outside the hospital or who has specific medical concerns, maybe a genetic disorder or an autoimmune disorder, something that necessitates a hospital delivery, a hospital, you're under the restrictions of that hospital. There's a lot of protocols that are put in place for liability reasons and other things, but essentially, once you step foot into that building, you are a patient. You will sign waivers, essentially consenting to all kinds of things based on what they deem medically necessary. The difference between a home birth and a birth center, I always say that it's your home or someone else's. There isn't necessarily anything about a birth center that makes it safer than a home birth. Sometimes, I guess if you live out deep out of Malibu or in Topanga and you're really far from a hospital, sometimes birth centers can be a happy medium because they're generally
Mm.
a lot closer to hospitals. But outside of that, it's your decor of theirs. They're generally staffed by midwives. Sometimes there's midwives and obstetricians. I think, again, it's just about whether you want to be in your space or theirs.
Mhm. Okay. Awesome. Another common question that we get amongst our community is, how do midwives go about structuring a birth plan? How do you guide people through a birth plan? I'm curious if you even like to do birth plans, because I know sometimes it can be kind of unpredictable, more or less.
Well, so it's not a like versus a dislike. Part of my job as a midwife is to inform my clients of risks, risk versus the benefits of anything that we consider like the standard of care. But it's also to respect their wishes, meaning that once I've given them their informed consent, I've said, okay, these are the risks, these would be the benefits, these would be the alternatives. Once they've made their choice, that's their choice.
Hmm.
We have declination forms and all kinds of things that people can sign, essentially saying that they don't want whatever it is that we're offering. But once that's done, I'm just there to respect their wishes. Obviously,
Right.
again, within, making sure that everything is medically sound, that mom's okay and that baby's okay. But I think by the time we get to that part, my clients and I, we have such a trusting relationship that if I'm making a recommendation on something that maybe they didn't think that they wanted before, I think we've established enough of a rapport where we can have that open conversation, and they know that I'm doing it out of their best interest and not trying to just railroad what they wanted. So, generally for the home environment, we don't even really have birth plans because essentially it's whatever you say goes.
Yeah.
If you don't want whatever newborn procedure it is, like I'm not going to do it, and I'm certainly not
Mm.
going to do it behind your back. Like it's not like I ever remove the baby from their mom in
Hmm.
order to do things without them seeing. So if a birth plan is made, it's usually made based on what would happen if we went to the hospital. And so that's a very different tailored birth plan,
Okay.
because you're not going to see a lot of the stuff that you might see if someone was intending on giving birth in a
Mm.
hospital. That's more like, okay, if we have to go to this place where we need medical care, we can't just have a list of no's. Like, I don't want an epidural. I don't want Pitocin, because if we don't want an epidural, we don't want Pitocin, we're just staying home.
Hmm.
But if we have to go to the hospital for those things, like, how can we make this as good of an experience as possible given the change of location? And so usually the birth plans that we're putting together are more tailored for if we have a hospital transport and less tailored for if we stay home, because
Right.
my clients know I'll respect their wishes no matter what.
Yeah. So all of the births that you tend to assist, they are unmedicated.
Mm-hmm.
Okay.
Because
Cool.
they're all at home.
Yeah.
Yeah.
Wow, it's kind of interesting because I remember I once chatted with, a mom who told me about her unmedicated birth, and, yeah, she was telling me that there's kind of like a high after having an unmedicated birth, so, yeah, I'd be curious to get your thoughts on that.
So my client this morning, right after she pushed out her baby, she goes, "Gosh, they make it seem like it's so difficult and so hard, but that really wasn't that hard." And obviously she's coming at it from like a very euphoric stage. She had a beautiful,
Yeah,
like pretty fast labor and it went really seamlessly. It was her
that's
second
awesome.
baby. But I think what she was touching on was more that I think in the hospital there's always so much chaos kind of going on around you that it
Mhm.
seems like a very chaotic experience. So the baby comes out, the baby's put on the chest, and then someone starts vigorously rubbing the baby and they're trying to get the baby to scream and they're moving the baby and they're listening to the baby and assessing, and someone's pushing her in her belly and trying to deliver the placenta, and there's so much going on around you. Where at home it's you deliver the baby's put on your chest, and we'll do the things that we need to do to assess the baby if we're concerned, and we'll listen to the baby, but no one's ever taking the baby from you. There isn't all this kind of chaos, this movement going on around you. It's very peaceful and
Mhm.
quiet. Um, but yeah, I mean, I I like to say that I think it's part of what we live for is that immediate high that follows a birth. So you
Mhm.
can watch a woman who, let's say, had a very long labor, who's working really hard at the end, and she pushes out her baby comes on her chest, she lets out a sigh of relief, and it's like someone flipped a switch, you know?
Mm.
This woman who was on, literally pulling from every source of strength she has in her body to get past this one point, then she's past it, and it's like she's a different person on the other side.
Yeah.
I think any of us birth workers would tell you that we live for those moments, and like
Mhm.
if we could bottle up those emotions and take them with us, we would. I don't
That's
think
so
it's like
sweet.
anything you'll ever experience in your entire life
Yeah.
outside of giving birth. It is
Mm.
just the best of highs. And you ride that high for days.
Yeah.
In a fully supported environment, you will ride that high for days. I'll come back and see my clients 4, 5, 6 days postpartum, and they're just still up there.
That's so sweet. What do you imagine as the perfect golden hour after birth in terms of, like, what should happen logistically?
Yeah, so I mean, there's things that I guess kind of like have to happen, but again, it's just sort of like tiptoeing around it, meaning that we're quiet, we're not too in your face, we're not too high intensity, I guess. But I in an ideal world, baby is born and put on its mom's chest, and they just stay there. At a certain point, the placenta will be ready to come.
Mhm.
Usually, mom will tell us that she's like feeling some pressure, she wants to push, and she'll birth the placenta. We'll literally wrap it in a Chuck's pad, put it in a bag, stick it next to her, and then we just leave it be. So, we're still assessing mom and we're still assessing baby, but it's just in a very non-intrusive way. At a certain point, baby will start rooting. Generally, babies born to unmedicated moms usually want to latch within the first hour. And so if the baby is showing signs and mom needs some help, we'll get the baby latched, and then we kind of just leave them be, mom, dad, baby to or mom, whoever, mom and their partner and baby to just get to know one another. And then, we really don't start doing things, I guess, until we're like more towards the second or third hour. And at that point, we'll do a full head to toe newborn exam on the baby. We'll
Mm.
help get mom up to pee. If she wants a shower, she can shower, and we'll help kind of facilitate all of that. And then eventually we'll tuck them all into bed and into clean sheets and be on our way.
Wow, that's awesome. How do you think about guests at birth? That's a common controversy on our in our community.
I think I think that everyone that is in your space that day has to be like personally invited by you. I
Mm.
like to say it's like the most exclusive birthday party you could plan for yourself, right?
Yeah.
So, and it can't be because you feel obligated to have them there or because they want to be there. You
Mhm.
actually have to want them there.
Right.
My aunt always said for every unnecessary person at a birth, add 1 hour to your labor.
Mm.
And the reason is because at a certain point in time, it becomes a show. Like
Right.
it is performative. If you feel like you can't let go in front of those people, you're never gonna let go.
Right.
I I have a lot of stories where there was probably too many people at a birth, and again, generally not invited by the couple, but
Mhm.
rather people who felt like they should be there who just showed up. Or people that maybe thought that they deserved to be there, and so they were kind of given an invitation based off of, what felt like obligation. And those births end up long. We sometimes end up in the hospital because of them, meaning
Mm.
that like we go in for pain management. So, try to keep the list short. Birth is not a spectator sport. It's not, again, my aunt always said the energy that gets the baby in is the energy that gets the baby out. Who
Mm.
was there while you were making that baby? Not all of us. So
Yeah.
try to keep it as intimate and as small as possible. But everybody there should be someone who feels like a necessary part of your team.
Right. Okay. That's excellent advice. I know you mentioned sometimes folks will go in for pain management. So during a home birth, at what point do you typically potentially look into shifting to a hospital?
Yeah. So outside of a medical necessity, I don't usually make the call to go in.
Mm.
If my client chooses an epidural, it's usually their call.
Okay.
I We all hit a breaking point in labor, meaning we all get to a point where we're like, wow, this is really hard and I don't know that I want to continue to do this. But it takes
Yeah.
a lot to actually pivot to want to go in and get an epidural when you're feeling those things.
Right.
I believe really strongly that women are capable of way greater things that they can even fathom.
Yeah.
And I know that during my labors, had any of my team said to me, like, hey, maybe you should go in and get an epidural, it would have knocked the wind out of my sails. If I
Mm.
felt like someone on my support team didn't believe in me, that would have been really, really hard for me.
Mm.
So when it comes to an epidural, that's usually a decision that mom comes to on her own. We
Hmm.
will wholeheartedly support her in that decision once she's made it because I know it's not easy. Now, I might say to her, like, give us an hour, let's see if we can shift
Yeah.
things. And sometimes that does work. Sometimes, like, kind of allowing her to release a little bit, like, she's now said it, she's put it out there, and just saying, like, hey, let's see if we can move things along and, like, just give us an hour. Oftentimes that can result in a baby a couple hours later. So buying that time will sometimes keep us home, but other times an hour later we're still in the same spot,
Right.
and we'll support her in making that decision to pivot to the new place of birth. But I don't think it's my job to define a woman's suffering, to qualify a woman's suffering.
Mm.
I think that again, women are capable of so much, and I feel like if my client asks me or says to me that she wants an epidural, I'll fully support her in that, but I don't ever need to tell a woman that she needs pain management.
Right. So if someone doesn't necessarily want an epidural at birth, but obviously there are pain management tools that need to be utilized typically during birth, what natural pain management tools do you recommend for birth?
Yeah, so I think it starts with a doula.
Hmm.
Doulas are extremely skilled when it comes to physical support. Again, whether it's through experience or through trainings,
Hmm.
generally they know exactly where to put their hands on your body to kind of relieve the sensations that you're feeling. I know it's something that I relied on in all three of my labors was some form of counter pressure or back support or something. So it starts with a doula for sure. In some cases, a really kind of well-trained partner can step in and help. But doulas are, again, they're worth their weight in gold. They're
Hmm.
such an incredible asset at a birth. We use a lot of water for pain management, so hydrotherapy, sometimes essential oils. But that's it. I mean, it's mostly our hands and water, to be
Okay.
honest. Yeah.
Cool. Like, how do you use your hands typically? Like pressure?
Yeah. Lots of counter pressure, lots of
Mm.
just like even just massage to kind of, you know, to kind of like trick the mind or shift the focus somewhere else. Most women experience some form of their labor in their backs and in their hips
Hmm.
as the hips are opening. So just applying a massive amount of counter pressure to what is that hip expansion.
Right.
I
A
mean,
hip
sometimes
squeeze.
that hip squeeze, let me tell you. Sometimes that's all you need.
Yeah.
Yeah. And that's also, I mean, if you're ever interviewing doulas and you're interviewing them in person, if people want a tip, sometimes asking them like to actually like feel their massage for a minute can be a really
Mm.
helpful tool.
Oh, that's a good tip.
Yeah, my midwife assistant, Johanna, she has extremely strong hands. I always say I'm so envious
Mm.
of anybody that gets to experience them actually in labor.
Yeah.
But she's been asked a few times, and I feel like it's her selling point. Like the second,
Yeah.
second someone feels her hands, they're like, okay, done.
Yeah.
You are my person.
That's such a good
Um,
tip. Cool. Well, I'd love to chat about postpartum care. I think something that's really unique about midwifery is continuation of the relationship into postpartum because I feel like we were talking about earlier, like in Europe, postpartum care I feel like is so much more prevalent than in the US and I think it could help solve a lot of maternal health issues
mhm.
if there was more postpartum care in the US. So in your eyes, what does postpartum care typically include?
Yeah. So my typical postpartum schedule, but I tell all of my clients that postpartum for me, especially when it comes to first babies, is very fluid. The needs of first-time parents as they transition into parenthood can be so dramatically different from one couple to the next. And so it's really fluid in the level of support that I offer. But my standard level, like just base level of care, is 5 postpartum appointments in the first 6 to 8 weeks. So we're typically with a hospital birth, you get discharged from the hospital, let's say day 2, sometimes day 4, day 3, day 4 if you've had a cesarean, and then you're only seen for one follow-up. Well, sorry, for C-sections, they're generally seen at 3 weeks and then again at 6 weeks. For vaginal births, you're only seen one time at 6 weeks. So it's like you go home, you have this new person that's entirely dependent on you, and then no one sees you. So postpartum has always been something that has been really important and a really valuable time for me. And I think it's really where we show up as midwives in so many ways. So I will go back and see all of my clients at 24 to 48 hours. Some second time moms, it's 48 hours, but 24 to 36 hours generally after they've had the baby. And I come to their home. For my first time moms, I'll see them again between 5 and 6 days postpartum. And then again between right around 10 to 12 days postpartum. And then I'll see them back in my office at 4 weeks and at 6 weeks. So 5 visits roughly in the first 6 weeks. And then for my second time moms, it's usually 4, just because they have a lot less breastfeeding complications. Generally, the postpartum period goes a little bit smoother, but sometimes I see them more often. It's really just based on the needs of each family. And I think that's authentic to how we show up as midwives in general, right? Is that no 2 clients are going to be the same, no 2 births are going to be the same. And so you show up in the way that your client needs you to show up. Sometimes that can be really draining physically and emotionally, but I kind of think it's what I signed up for.
Yeah.
But to touch on something you talked about in Europe, I had a client who had her 3rd baby with me earlier this year, or Christmas time last year. And she was from the Netherlands. And she told
They
me
have
that
really good postpartum care.
Oh my God. She told me that in the Netherlands, you generally only stay in the hospital for 12 to 24 hours. So if you had an unmedicated birth, or even if you had an epidural and you had a vaginal delivery, you only stay in the hospital for 12 hours. If you had a C-section, you stay in the hospital for 24 hours. And then you go home and you have an in-home nurse for 8 days straight.
Yeah.
And she's like, and I was like, okay, so what do they do? Because it's like 9 hours a day that they're in your house. What do they do? And she's like, anything you want. They'll check your vitals, they'll help you with breastfeeding, and they'll clean their toilets if you want them to. And I thought that was the most fascinating thing because, here in Los Angeles, the average birth in a hospital costs $55,000. That's for an uncomplicated vaginal delivery.
Yeah.
Imagine that we just shifted those resources from like an insurance perspective even.
Right.
So imagine you only spend 12 hours in a hospital and then you go home and you have a nurse in home for 8 days. There is no way that you're hitting a bill of $55,000.
Right.
But somehow it's, I guess, just the system that we've decided we want to put up with.
Yeah. Yeah, I read an article in Finland. They give you kind of like a postpartum care box.
Yeah, the baby box.
Yeah, the box itself also doubles as a crib, which may not necessarily be like the safest option, but it's just so interesting that there's so many resources dedicated to the postpartum period. And I feel like in the US, it's kind of like, see you later.
In France, every woman sees a pelvic floor therapist, which is huge because it's something that I think we often don't talk about in this country is the need for pelvic floor therapy. I've had a lot of clients who had instrument deliveries, so vacuum or forceps deliveries, had episiotomies cut with their first babies, and they sought out postpartum care because it was something that they heard about and were like, "Wow, this is a really big problem. I need to go get this fixed." It's incredible to me because when I see them, I'm like, yeah, of course you should pelvic floor therapy after you had a vacuum delivery. Like, talk about damage to the pelvic floor, but. Yeah, it's amazing to me, I guess, the resources that are offered in other countries. And I don't, most of those countries are going to have national healthcare systems. And I don't think that's an excuse for why we don't have those things. I think ultimately it comes down to demand. And it's the same thing with home birth. Insurance doesn't cover home birth. If you want your insurance to cover it, you have to fight for it. So, here your insurance would pay Cedars-Sinai Hospital $50,000 for vaginal delivery, but they won't pay, $10,000 to have a home birth. That's crazy to me.
Yeah.
But it's all about consumer demand, I guess.
Yeah. No, definitely. I'm curious if there's anything that you look for while you're doing your postpartum checkups in terms of things that people should not do after birth or that they should do after birth, or like red flags or green flags that you look for during the postpartum period.
One of the things I've learned over the last few years is that I think you have to meet every client where they're at. So you have to be fluid in your standards of care. Like there's no one size fits all. So there's many books written on the postpartum period, many that would suggest, there's countries that fully sit in for 40 days postpartum, right? They have a full sitting in period. Or I think it's in Korea where they sit in for 30 days, right? And then they do a
Yeah.
whole kind of celebration when you come out of that sitting in period. And I think that that's great for some moms, but I think for others, it is such an unnatural state for them that you have to be fluid with them as well.
Mm.
So like I had a client a year ago who, she was out doing the Santa Monica stairs the day before she went into labor. Her natural
wow.
state is to be in constant movement. The
Mm.
woman doesn't sit down. And so for her, when she was like walking to Abigail at 4 days postpartum, I was like, oh my God, what are you doing? Like, go home. You have a wound this big in your uterus right now. But for her, like her normal state was movement. And so she went home and she tried to sit for another 3 days. And she's like, Abby, this isn't me. This isn't natural to who I am. And she was right. Like she didn't have a tear she needed to take care of. She wasn't bleeding excessively. And her body was used to that level of movement. I mean, if anything, like just going on a walk to Abigail was the least amount of movement she had done in, years.
Yeah.
So I think when it comes to postpartum care, it's understanding your client, which is why, again, what I think is such a beautiful part of this model of care is the, 45 minutes to an hour long appointments that we're going to have throughout the entire course of your pregnancy. That's really going to show me who you are as a person.
Right.
It's understanding who your client is and then essentially being fluid with what that looks like for them.
Mm.
In an ideal world, everybody has a baby. They are resting for the first 5 days. They're staying in bed as much as possible. They're feeding their body with nourishing foods. They're replenishing their iron stores. They're drinking a lot of water. They're nursing their baby. They're doing lots of skin to skin. But for the mom who wants to walk to Abigail at 4 days postpartum, if that's what feels healthy and normal and okay for her and her body responds to that beautifully,
Right.
then that's what she needs.
Okay, awesome. Well, another common postpartum question is what should you expect 2 weeks postpartum in terms of, I guess, things you might look for, but also like what the experience might be for each parent, or I don't know if there's even a standard answer for it.
No, 2 weeks postpartum. Again, first baby or second baby or fourth baby, 2 weeks postpartum, you're still a very good friend of mine who's a lactation consultant. She calls early parenthood for first parents baby Vegas. 'Cause, you just like kind of lose sight of things in Vegas. So she thinks that new parenthood that just feels like baby Vegas. So like 2 weeks they think is like when the sun starts shining again and you're returning to some sense of normalcy.
Okay.
Or rather, you figured things out a little bit more, It's like you're not leaving the house forgetting diapers or you're not like, generally we've worked through a lot of struggles with breastfeeding, like postpartum recovery, like you're starting to feel more like yourself.
Mm-hmm.
But for a lot of second-time moms, I mean, they're, doing surprising things at 4, 5, 6 days postpartum. I've had second-time moms at church the following Sunday after having a baby. So I think it just depends. But I think for most second-time parents, they would say that 2 weeks you're just feeling feeling good.
Cool. What are the most common issues that you encounter postpartum?
Mastitis is a big one. I think that we definitely don't talk about it enough.
Yeah, we've actually never talked about it on this podcast before. So if you want to explore that or just even define it so people know what to look out for.
Yeah, mastitis is probably the number one postpartum complication I get. So mastitis it's an infection in the breast tissue. So it's common or very common amongst breastfeeding mothers.
Right.
What
typically causes it? A clogged duct?
Yeah, so it is a clogged duct that then, because the clog wasn't released, the tissue around that starts to get inflamed and infected.
Mm-hmm.
And so anytime there's an infection in the body responds by putting up an immune response essentially to attack. And generally that means a fever. Mastitis usually presents with a very low-grade fever and flu-like symptoms. Mm-hmm. Whenever I get a text within like the first 2 weeks postpartum and a mom's like, I have a fever, it's like 100.1, and I'm getting lots of body aches. I'll say, is there a part in your breast that feels tender and achy? And usually, most commonly, the answer is yes. And generally, it kind of presents with like inflammation in that area. So you see like a big red spot in that area, and it can really knock a mom on her butt for a little bit. It thankfully will resolve with proper treatment very quickly. So once we get on working out the clogged duct, and there's for anybody who's listening who doesn't have the same resources, I guess, available to them as my clients do, my friend Julie Matheny, who runs she's LA Lactation on Instagram, she has a great massage. This is my waking up at 4 o'clock in the morning brain right But it's a tissue massage that works
Yeah.
like from the armpit up, and like I will have my clients start doing that, and then just supporting their immune system, making sure they're hydrating, and then breastfeeding on demand is a
Mm.
common misconception that you can't breastfeed from an infected breast, and you absolutely can. It is not infecting the milk; it is the actual breast tissue that is infected.
Mm.
But nursing on demand, and then just working the clog out in various different ways can be super helpful. But LA Lactation on Instagram, she's phenomenal. And then my friend, who I can credit with Baby Vegas. Her name is Lauren Archer, and she's Love of a Little One on Instagram. And she has a wealth of both of them are just encyclopedias when it comes to all things breastfeeding, and they are great people to follow for
Yeah, that's
free
awesome.
advice.
I might hit them up to be on this podcast.
You should you should definitely. I mean, the two of them, I probably hit Lauren up twice, and she actually just had a baby with me
Awesome.
2 weeks ago. She
Oh,
had her
wow.
second, yeah. But I probably hit Lauren up a couple times a week, if not more,
Yeah, that's so
with
cool.
breastfeeding issues. Yeah,
That's great.
she's great.
Awesome. Well, another really common postpartum question is when should you expect your first period postpartum?
Ooh, it's so different for everybody. Generally, when breastfeeding, and I want to be clear that it's breastfeeding on demand, meaning that you can't be doing any sleep training or trying to feed on a schedule.
Right.
When you're breastfeeding on demand and it has to be at least 2 times overnight, you can anticipate going without a period for at least 4 months. It's actually a method of birth control called lactation amenorrhea. It's the absence of a period due to lactation. That is pretty much, I think they say it's like 94 to 95% effective for
Oh, wow.
women that are breastfeeding on demand. But it varied. Using myself as an example, I didn't get my period back with my first until I was 16 months postpartum.
Mm. Wow.
Um,
Were you breastfeeding the whole time?
yeah. And he ate around the clock.
Yeah.
Yeah. And that kid, I like to joke that he would have breastfed until college if I let him. But for some, they get their period. I mean, my cousin is a good example. She got her period back at 6 to 7 weeks postpartum. And she was definitely breastfeeding on demand. Her kid was
Right.
that. Very healthy milk. But so it varies for each. Most women can expect if they're breastfeeding on demand to go with at least 4 months without a period.
Right. Okay. Along a similar vein, during the postpartum period after birth, when should parents begin looking into birth control option? Yeah, or even should they be?
I mean, I love a good oopsie. Repeat clients, repeat business. No, so, I think a lot of my clients choose not to go on hormonal birth control. So they kind of ride out the lactation amenorrhea method. And then when their period does return, most of my clients will utilize some form of natural family planning. So just like charting their cycles to avoid another pregnancy. But like if they wanted to use a barrier method, you can start that at any point in time. If you wanted to go on condom or use condoms, for instance, they should introduce that as soon as they start having sex again, which, for some women, it's going to be right at 6 weeks. For others, they're going to need a little bit more time to recover and just kind of get back in touch with that part of their body again. But condoms can be utilized pretty much at any point in time. And then for other methods of birth control, as soon as there aren't a lot of options when you are breastfeeding because hormonal effects that it can have on breastfeeding. But they would want to start seeking out options as soon as, 6 to 8 weeks postpartum if they want to go back on something hormonal.
Right. Isn't there some kind of rule? I'm forgetting what it is, but around getting an IUD at around 6 weeks? Especially if you've had I think it's I forget what it is.
I mean, so again, there's only one option for an IUD, and that's while breastfeeding, and that's the copper IUD. And I think there are women that have it placed at 6 weeks. I don't do them personally, but I think you can have them placed at 6 weeks.
Okay.
Yeah.
Cool. Awesome. Well, yeah, another really common question is how can I naturally help my postpartum recovery? What do you recommend in terms of especially foods to eat? I think is a common question. And just generally taking care of oneself.
Yeah. So there are some really good books out there that talk about nourishing your body postpartum. The first 40 days is a really popular one. And Nurture is another one that kind of dives deep into how to support your body in the postpartum period. I think rest is super important. I mean, for most parents, the first time they have a baby is going to be a major adjustment to their sleep schedule. And while many of us seasoned parents kind of got used to it after the first, it can be a really big change. And so just making sure that you're getting adequate amounts of rest in the first few weeks, because night times can be really, you're in Vegas, remember? You don't sleep in Vegas. So lots of rest, making sure that hydration is number one. I think that we're so hyper focused on making sure our baby's hydrated that we often forget
Mhm.
about ourselves. And then just nourishing iron rich foods. Most of Eastern, tradition is to put warm foods back into the body post birth. But the first 40 days is probably like I think the most popular cookbook when it comes to postpartum support. I will also say that in many places, LA definitely has this. If it's an option to you, a postpartum doula who offers meal support is
Mhm.
a phenomenal investment. Many of my friends that are like very skilled birth workers who have, walked women through this on this path many, many times before, they focus a lot of their postpartum care on foods, and finding someone who can support them just by nourishing them in the postpartum period. So if it's in the budget or if it's an option to ask people at your baby shower in lieu of gifts to
Mm.
maybe kind of put together a fund for postpartum support,
Right.
I mean, it can make a monumental difference in how you feel.
Yeah. Okay. Yeah, that's a good tip. Yeah, I think I've once a doula told me that she thinks the best gift if you're wanting to visit after birth is to just bring foods and especially frozen foods because yeah, you don't want someone just coming over to like hold the baby, but to really provide support.
Yeah, soups are something really
Yeah,
easy to like pop in a freezer and then just throw them in a pan and warm them up. Anybody can do that.
right.
Or even like if you're going to visit a friend, go to Erewhon. Their soups are incredible. Pick up a bunch of jars of soup and just bring them over.
Yeah.
Moms, I was talking to a new mom a couple months back, and she was talking about, kind of envisioning what life was going to be like on the other side of having a baby, and it was her first. And she's like, "Well, I'll have time in between breastfeeding and to get food to make myself food." And I was like, "Hun, your first baby, it's this whole new world for you, and you just want to sit there all day holding them, studying them, counting their fingers and toes. And so yes, you'll breastfeed for an hour and the baby will fall asleep, and then you'll just want to lie there with your baby on your chest. And
Mhm.
so before you know it, they're up again to breastfeed, or they need to, you can't put them down. So to have something, to bring something to someone that they could just easily make for themselves that is nourishing, replenishing the body, that's the best gift you can get.
Right.
There is subscription. Like I have a very dear friend. She was a client of mine, became a very dear friend. She moved to Austin, and she got me a beautiful postpartum herbal support.
Mm.
It's called Milk Moon Herbs.
Okay.
She makes the most beautiful, delicious products. Like, I absolutely love her stuff. So, in return, not to get her the same gift when she had her third baby, I sent her Mother Bee's meal services. Like, I
Mm.
just sent over essentially, like, it comes with like a variety of teas and breakfasts and congee and other things. But if you want to gift someone something, that is a wonderful gift to get someone, is just like a postpartum meal plan or meal support. And we've got, I mean, certainly in Los Angeles, we have ton.
Yeah. Okay, that's a good tip. What should partners know about the postpartum period and what can they do during that time to best support?
Um, when I was pregnant with my third, I was like a full practicing midwife. I had my own very busy practice, and so I had a lot of time to consider while kind of being pregnant again and walking this journey with other women. A lot of things I thought about a lot of things, and one of the things I kept telling myself is that pregnancy and postpartum is in some ways the most nonsensical, illogical time in a woman's life,
Mm,
because there is no rhyme or reason sometimes to why you are feeling the way that you do.
mm,
There's no rhyme or reason to why that food sounded amazing 5 minutes ago and now it makes you want to vomit. So you kind of just have to go with the flow. Support her in that transitional period, whether it's through pregnancy. I mean, I think we emphasize postpartum, but there's so many transitions that happen in a woman's body during pregnancy. And it's just about being fluid with her, talking through any fears or anxieties that she might have, and understanding that there may just not be a reason to
mm.
why she's feeling the way that she is. And you kind of just have to go with it. But especially in the postpartum period, her body is being her body is being asked a lot of. She's in high demand from the baby, and in some ways she may even feel touched out very early on. So
Mm.
it's about feeding her, it's about nourishing her soul, it's about talking her through whatever it is that she's going through emotionally, and just understanding that, any way that you can lend a hand, whether it's, hey, I'm going to the kitchen, do you need more water, or just bringing her that water. You know, bringing her a snack because she probably hasn't even thought of herself all day. Just showing up, just being supportive in whatever way you possibly can be, because she really is. She's going through a lot. And I think while, yes, a dad's or a partner's life will change when their baby is born, it never changes as significantly as the mother's. It is just,
Right.
it's a different level of change. And so, just really acknowledging that and showing up for her in the best way you can.
Right. Okay. Good tips. My last question is around postpartum depression, since that's a really common aspect of the postpartum period. So, who do you think is at particular high risk for postpartum depression, and what are your general tips if someone thinks they're experiencing postpartum depression?
So it's really interesting because postpartum depression nationwide is very common. It is not very common in my practice.
Mm,
In hundreds of women served, I've only ever had 3 cases of postpartum depression. I mean,
okay.
that's significantly lower than what we see as the standard rate of postpartum depression in this country. And I think that's because it starts with support.
Mm,
Again, you have a baby, you leave a hospital, and no one sees you for 6 weeks. In that time period, though, your pediatrician will see your baby 3 to 4 times.
mm-hmm.
So we've put an emphasis on the baby's care, but who's checking in on that mom? And then
Yeah.
you go to the pediatrician appointment and they might ask you a few questions about how you're doing. And then you'll go to your 6-week postpartum and you fill out something called an Edinburgh scale to assess whether you have postpartum depression or not. But that relies on someone feeling comfortable talking to their provider about how they're
Mm-hmm.
feeling. Well, when you've gotten to know someone for only 5 to 7 minute long appointments over the course of your entire pregnancy, how comfortable are you going to feel talking to that person about what you might be experiencing? And maybe that person's a man and he can't understand what it is you're going through, even though he's an obstetrician.
Mm,
So I think it starts with support, having proper support in the postpartum period, normalizing what women are going through during that time period, not forcing them to do more than they're ready to accept,
right.
not encouraging, things or not, I think like sort of devaluing the experience by, saying like, oh, your baby doesn't sleep great yet. Because it makes a woman feel like there's something wrong with her.
Yeah.
And then I think it's just, so I think it starts there. It starts with, access and support from your providers and having good postpartum care that really elevates the mom's care post birth and not just the
Mm-hmm.
babies. And then again, accessibility, just setting them up with resources from the get go. But my clients who have had postpartum issues, they know that they can call me, whether they're 4 months postpartum or just recently 7 months postpartum. No
Mm,
matter what stage of the postpartum period they are, they know that I'm a resource that they can come to give them more resources.
yeah.
But anytime a woman has suffered from anxiety in the past, I think it's great to just have a postpartum plan in place. Interestingly enough, my clients that have had anxiety or have suffered from anxiety in the past generally don't end up with postpartum depression
Mm,
because they are so well set up to
mm,
experience it that they've
right.
actually kind of put together a plan to avoid it.
Right.
So it's having the resources available to you. So you know that like if you've had anxiety before, find your healthcare providers, find your counselors, find your specialists, your therapists, your psychologists, your psychiatrists, the people that specialize in that area and have them set up. And then again, I think if you're nourishing your body postpartum, if you're otherwise feeling good, I think that affects your mental state as well. And so
Mm-hmm.
I think, it all just kind of starts there. It's making sure that you're well supported initially, you're well taken care of, you're taking care of your body. And I think generally, the mind will follow.
Right. That's great. Awesome. Well, that's all the questions that I have, but I really, really appreciate you coming on. And
Yeah, it was so fun.
yeah, especially because you have such a supportive practice and also a really, really great Instagram. If anyone wants to look you up, where can they find you?
So my Instagram is LA Midwife Abby. We also, me, another midwife, Johanna, and an obstetrician here, Dr. Affleck, we also just set up a birth collective called the LA Birth Collective, where
Cool.
we have our own individual practices and space for classes and all things that matter to us, mom, baby. So you can also find us at LA Birth Collective.
Okay.
But
Awesome. Do you
yeah,
happen to serve non-LA parents
meaning
via telehealth or anything like that?
I don't. I wish I had kind of the space to do it all. But when people do reach out to me, I generally try to answer their questions. I get asked a lot for like midwife referrals.
Right.
It's probably the most common question, and I always say back, so I'll just say it here too. Ask your local birth provider, like your
Yeah.
local birth workers, doulas, and other things for their favorite providers, because generally they know all the good people. But no, and I've been asked to like fly out to births and stuff like that. It's really challenging to like fit that into the schedule.
Yeah. Life of a famous midwife.
Yeah, it's like, yeah, it sounds fun, but also kind of daunting. But yeah,
Okay. Awesome. Well, thank you so much again. I
thank
appreciate
you.
it.